I am an orientation and mobility specialist.
I'm a lawyer.
I'm a firefighter.
I'm an advocate.
I'm a sister.
I am a mother.
I'm a friend.
I am me.
I have bipolar disorder.
Depression.
On borderline personality.
I'm not embarrassed.
1 out of 5 people lives with a mental health condition.
We're all people, and if we talk about it, there's hope.
Hello, I'm Karl Shallowhorn, board member for the Erie County Anti-Stigma Coalition. And on behalf of the coalition, I'd like to welcome you to our Facebook Live program, Dispelling the Myths of Bipolar Disorder. Bipolar disorder is a misunderstood illness. According to the National Institute on Mental Health, it affects approximately 5.7 million adult Americans, or about 2.6% of the U.S. population age 18 and older. Every year. The median age of onset for bipolar disorder is 25 years, although the illness can start as early as early childhood or as late as the 40s and 50s. An equal number of men and women develop bipolar illness, and it is found in all ages, races, ethnic groups, and social classes. More than 2/3 of people with bipolar disorder have at least one close relative with the illness or living with unipolar major depression, indicating that the disease has a heritable component. In today's discussion, we're going to explore how it's possible to thrive with the illness from 2 individuals who each have a unique perspective on this topic. Before I introduce our panelists, here are a couple of housekeeping rules. Our program is for 1 hour. During this time, if you have a question or comment, please type it into the comment box and we can respond accordingly. Today, I'm joined first by Danielle Bernas. Danielle is an LMSW and director of the Refugee and Immigrant Center for Healing at Jewish Family Services of Western New York. She has 20 years of experience working with diverse and unique populations, including refugee and immigrant communities, Native American communities, families involved in the child welfare system, individuals involved in the criminal justice system, and individuals experiencing severe persistent mental illness. She has experience in individual and family support services, including individual and group mental health counseling, with a focus on trauma-informed and culturally responsive care. Danielle is a board member of the Erie County Anti-Stigma Coalition and University of Buffalo Field Advisory Board. She's also a member of the steering committee of the West New York Refugees with Disabilities Task Force and chairs the Pathways to Citizenship Committee. She's a doctor of social work student at the University of Buffalo with a focus on culturally responsive K-12 educational settings. And also Danielle happens to live with bipolar disorder. Next, we have Kelly Dumas. Kelly Dumas is a licensed clinical social worker, nonprofit leader, and advocate dedicated to advancing mental wellness in Black and BIPOC communities. As the founder and CEO of Dumas R.I.S.E. Providers Incorporated, she leads initiatives that support mental health professionals of color, including training, mentoring, and workforce development. Kelly also operates Dumas R.I.S.E. Kelly also operates Kelly Dumas LCSW PLLC, a private group mental health practice in Buffalo, New York, where she provides individual, group, and family counseling. With extensive experience in clinical practice, peer support, and mental health education, Kelly brings a clinical lens to this discussion with value placed on centering the importance of lived experiences. She's passionate about breaking down stigma, expanding access to care, and integrating holistic and community-based approaches to mental wellness. Welcome, Danielle and Kelly.
Thank you.
Thank you.
So I'm going to start with a question for you, Danielle. And it's a pretty simple one. How old were you when you were first diagnosed with bipolar disorder, and what were some of the symptoms you first experienced?
Yeah, so I believe I was 25 when I was diagnosed. It's a little difficult to remember exactly when I was diagnosed. I was not in a very good place mentally. I did start experiencing symptoms in my early teenage years, so very early on in life, and it was something that I dealt with for a very long time and something that I didn't quite understand until I sought out treatment and received the diagnosis, and then started on a pathway to healing. I started to experience suicidal ideations again. I talked a little bit about this in my story of hope, but I had attempted suicide 3 times by the time that I received my diagnosis, and took advocacy into my own hands and sought out treatment. And it wasn't until I started to experience suicidal ideations again that I sought out treatment. I wasn't sleeping, I was irritable, I was back to making reckless and impulsive decisions that were really impacting my ability to function and hold a job. Um, it was around this time that I was asked to resign from a long held position that I had. I could no longer fulfill the responsibilities of the job due to cycling through hypomanic and depressive episodes and mixed episodes. And honestly, I had refused to seek out help until that point to mitigate the challenges I was experiencing at work. And foundationally speaking, that really starts with my childhood and the environment that I grew up in, and we didn't talk about mental health. And so it wasn't a priority for me until it had to become a priority.
I was going to ask you that. I'm glad you mentioned your childhood. So, how did your family respond to this when you were experiencing symptoms either early on or when things came to a head, like you said, with your the suicidal ideation? How did they respond?
So early on, it was very difficult managing the emotional distress that I was experiencing because we didn't talk about mental health. It was an approach of it is what it is, get over it and move on. There was a very strong aversion to medication. And so that limited me. It really wasn't talked about in my early years. And like I said, it wasn't until I sought out treatment on my own. And by that point, I was living on my own. I was an adult. And I was able to move forward with making my own decisions, kind of free of that environment, unfortunately. And when I received my diagnosis, it wasn't until years later that I actually had a conversation with my family about it. And it's taken some work to get to a point where it's been accepted. I don't think that it's quite understood still, but it has been accepted. And my parents have become two of my best friends and have become incredibly supportive and two of my strongest supports in living with bipolar.
That's wonderful that it worked out that way. Because and I'm sure many of our viewers know, it doesn't always work out that way.
Yeah.
Sometimes families don't come to terms with it, and it really impacts the individual who's living with that condition. So, Kelly, let's go to you. So, what do you see as some of the misconceptions that people have about people who live with bipolar disorder? What are things that you see?
Yes, thank you for the question. I think when we talk about mental health overall, there's many different misconceptions, but particularly with bipolar, I think many people mistakenly believe that bipolar disorder is the same as dissociative disorder, which is another, some people know it as split personality disorder. And so that myth that people who have bipolar have a split personality. Bipolar is really a mood disorder, and it's really characterized by shifts in energy, activity levels, and mood. So it's not someone having multiple identities. Another stereotype, sometimes I think, media plays a big role in how we perceive and understand many things, including mental health. And so oftentimes the media can portray individuals with bipolar disorder as being unpredictable or dangerous. So what we know is that with proper treatment and proper support, people with bipolar disorder lead very stable and fulfilling lives. They're not erratic and violent, as sometimes can be portrayed in different instances within the media. Another stereotype that kind of comes to mind is, well, I just mentioned, and glad Danielle is with us. She's people with bipolar disorder is a stereotype that people with bipolar disorder can't live normal lives. However, people define normal, whatever normal is. But many people tend to assume that, a diagnosis of bipolar means, people may be unable to work, they can't have relationships or be successful. So again, we know that that is a myth, that's a misconception. Self-management strategies, treatment, support, there are no limitations to what someone can achieve. People with bipolar disorder can thrive. And then the last one that I thought of in terms of some misconceptions is the manic episodes. I think a lot of times when people think of mania as it relates to bipolar, some people tend to think that it's just an elevated mood of just being really happy, and it's really more than that. Oftentimes when someone is having a manic episode, it comes with impulsivity, risky behaviors, and sometimes there's psychosis that can be involved. So it really is a serious medical condition that requires some treatment for management.
Let's talk a little bit more about that idea of the psychosis, because that's something that is really misunderstood.
Yes.
And it's a feature that's associated with a number of mental health conditions. Tell us a little bit more about, describe psychosis, what that is, and how it might affect a person.
Absolutely. So when we're talking about psychosis, it's really looking at someone's ability to be in touch with what we know to be real versus maybe what there's sometimes when folks are experiencing psychosis, they could be seeing things that are not visible to others. They're not physically there, but they're having visual psychosis. There could be audio psychosis, hearing voices, hearing things that are not really there. It could affect thoughts, voices telling you to do things, to act in a certain way, engage in certain behaviors. So those psychosis is a serious medical condition, and as you mentioned, it is linked with many different mental health diagnoses, and they can be very well managed. They can be very well managed with medication, with various interventions. So, but it is not something that should be ignored, because if it is ignored and untreated, it could lead to some unhealthy things we don't want to see happen.
Thank you for that. Thanks for that
Yes.
explanation. So going back to you, Danielle, what are some of the traditional tools, and I say traditional, things that you do to stay healthy and manage your condition? Do you use medication? Do you go to therapy? What would you say?
Yeah, before I answer that, I kind of want to touch on what Kelly was talking about and misconceptions and myths. Honestly, when I was diagnosed, I celebrated my diagnosis because it finally explained, and I hope that other people can find celebration in this as well, as opposed to resentfulness that they're living with this condition. I celebrated it because it was finally an answer for me, and it explained all of the things that I was going through. And it put me on, like I said earlier, my pathway to healing. And it was very much empowering for me to be able to take treatment into my own hands and move forward and find some hope that I would be able to move forward with all of the goals that I had in my life and all of the things that I wanted to achieve. We talked about achieving things. I feel like I'm very accomplished in my career. I am accomplished with my academics. I am a doctorate student right now. And so I wanted to touch on the fact that, yes, this condition does not limit you if it is properly managed. And the way that I manage my condition is through therapy and medication. And honestly, I think that the combination of the two is really vital to keeping individuals stable. And a lot of people, Karl, you touched on this. I'm very fortunate. I understand that. And I definitely recognize that. I'm very fortunate that I have support in my parents. And I went from an environment that was not supportive to an environment that's been incredibly supportive. That doesn't always happen for individuals, and individuals don't always have strong support systems, and that's why therapy and medication can be so critical to stability. But to be honest, I have to remind myself of that sometimes when I'm in a stable place. A part of me feels like I no longer need the medication. And I think that's not uncommon for a lot of different mental health conditions when people start feeling better. But I have to remind myself that I'm in the place that I'm in because of my medication, because of my therapy that I'm receiving, that I have been receiving and may need to receive for the rest of my life. And I have learned to accept that. I mentioned there was a strong aversion to medication of any kind in my household, whether it be for physical health or mental health. And so I think the foundations of that particular thought that I no longer need my medication kind of lies in that. And so that really demonstrates the impact of the environment that you're in childhood and how that can impact your adult life and kind of carry through the life course. So that is something that I do struggle with, is that particular thought. Like I said, my relationship with my family has changed significantly over the years. My parents are my best friends, and I seek them out for support often. So they are part of my support system. My partner is also a great source of support, even through all of the ups and downs, which I do experience from time to time. And it took a long time to find the right combination of medication that would at least keep me at baseline. And I'm actually at a point in my life right now where, due to some side effects, we have to look at some medication changes. Mm-hmm. And so I had to prepare myself for that, in the understanding that, that may impact some of my emotional regulation. But I do have the support system that I need. I have the therapy that I need to support me, and my prescriber to support me.
A couple of things I want to mention before I kind of follow up with this is it's so important to be proactive with your treatment as opposed to reactive. And what you're describing, Danielle, is exactly right. I mean, you're kind of approaching this from the perspective of things are changing, maybe with the way that I'm reacting to the medication, or I'm the side effects I'm receiving from medication. So there may be some changes necessary. How can I prepare myself for that? What do I need to do to be able to work through whatever changes there might be with how I feel with this new medication? I want to ask too, though, any other self-care tools that you use besides the traditional ones?
Yeah, so I was actually going to touch back on that. And what I didn't mention is I am an introvert. I love my alone time. So alone time, meditation, yoga are really useful tools for me to allow for reflection and introspection, especially when it comes to my mental health and stability and managing each day. I'm also an avid reader, nature enthusiast. I love hiking and kayaking and traveling, especially internationally, is when I find the most joy and happiness and honestly perspective on my mental health and its place in my life. And these have all been really useful tools. And as I'm going through these medication changes, they're going to be the other useful tools that I have in my toolbox that are going to help me get through any potential emotional dysregulation or any side effects from going through a medication change.
Thank you. That's a great response. So we're having some questions coming through our chat. And then remember, if you have a question, just type in the comment box and we'll get to it. So the first question is, and this is actually something that maybe we'll go back to Danielle, but also feel free to respond as well, Kelly. What advice would you give to someone who has recently been diagnosed with bipolar disorder and is struggling to accept it? So maybe Danielle, and then we'll go to Kelly, because I think you both answered.
Yeah, so it is very difficult to accept. I think that's where all of those supports come into place. And you should talk with a therapist about how you're feeling and the challenges that you're experiencing in accepting this diagnosis, and really talking through what this means for the rest of your life, and talking through how to find hope as opposed to that resentment maybe, or that denial that this is your diagnosis. Like I said, my experience is probably very different than a lot of individuals who don't want a diagnosis like this, but I celebrated mine because I suffered for so many years. And I think that's a really good way to look at it, is probably by the time somebody has sought out treatment, they've been suffering. It's been impacting their life and their ability to function to a certain extent. And finding purpose in the diagnosis that allows you to be stable and not suffer like that any longer.
Before we go any further, and I'm going to actually ask you, Kelly, in a second here, just want to remind folks, if you're just tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition. I'm joined by Danielle Bernas from Jewish Family Services and Kelly Dumas, from founder and CEO of Dumas R.I.S.E, Providers Incorporated, and private practice clinician. So Kelly, how would you like to respond to the question on someone who's recently been diagnosed?
Yeah, so I'm so glad to be a part of this discussion, and with Danielle speaking with the lived experience portion, because I think, someone that's struggling with accepting the diagnosis. So for me, I'm coming from my clinical kind of approach and lens. I'm thinking getting under what is that resistance about, and it's probably because I was listening to Danielle express, and everyone's experience will be different, but I know how you talked about, you celebrated, it was finally I have some answers. So someone who's struggling is probably, maybe I would venture to say, not wanting to be labeled because of the negative stigma that could come along with labels with some diagnoses. And so as a therapist, really, I tell people, I don't like to focus too much on the label of the diagnosis. I think I try to get people to understand we need the diagnosis. It gives us the language so that we can better understand what it is that we are treating or working with. Just like you would need a medical diagnosis if you're going and you need a diagnosis, so the doctor will know how to prescribe and what may be most effective to help you in getting better. So maybe providing some information and talking about what is the resistance, and then understanding that you are not your diagnosis. You are not your diagnosis. This is just a label, some language we need. So the insurance company, if you have insurance, the insurance company can understand what we're treating, what we're working on. And then we have some information that helps us to know what works, what helps, what's most effective. So I think someone struggling, it's really about maybe having that more of a conversation, a dialogue, and understanding where is that coming from. And if through I think the more that people are exposed to conversations such as we're having today, where they're able to hear from folks who are thriving and successfully living with various diagnoses, it helps to kind of remove some of that stigma and that resistance to saying, I don't want to be labeled with this.
Thank you for that. That was wonderful. Did you want to add anything, Danielle? Yeah, go ahead.
I did, yeah. While I celebrated the diagnosis and I felt like it empowered me, I still experience moments of, I keep bringing up resentfulness because that's how I feel. I feel sometimes resentful that I have this condition, and that it does mean I have to put certain supports in place in order for me to be healthy that maybe other individuals don't have to do. So it's very possible that you're always going to experience that, even once you do accept your diagnosis. And I think with bipolar disorder, you need to understand that it's not going to be a straight line. You know, there isn't a cure. You're still going to experience your ups and downs. And hopefully with the tools that you have in your toolbox, I always call it a toolbox, because if one thing doesn't work, you pull something out of your toolbox and it doesn't work, pull something else out of your toolbox, and just have a bunch of different tools until you find the right one that works for you, to help you get through this. And I like that Kelly said, you are not your diagnosis, because this is something I shared in my story of hope. I am not my diagnosis. And it's something I remind myself of every day. I am not my diagnosis, and I have been able to accomplish the goals that I've wanted to accomplish.
Thank you, Danielle. I appreciate that. Kelly, I want to ask you this one. This is another one from the audience. And remember, folks, you can just type a comment, your question in the comment box. What types of behaviors or cues should we as parents, family, or friends look for in bipolar? If someone's living with bipolar versus someone who may be just feeling off, whatever off means.
Yes, that's a good question. You know, for most of us, you know, if we're talking about our loved ones, our friends, our youth, our siblings, whoever who may possibly be experiencing a mental health episode, how do you recognize that? So I think, of course, you know, the baseline, what is typical behavior for individuals around us. Typically, we know what's again, that word normal. I use that in quotes because that's however you define normal would be. Once you start noticing some severe changes in typical behavior, that's when we should start paying closer attention. So severe mood swings, when we talking about youth and teens who are also going through regular adolescent puberty and changes, you are going to expect some mood swings and changes. But these are things that may be a little more severe, lasting long periods of time. If you're noticing difficulty with maintaining friendships or in school performance, so things that are just not really typical for what you would see in an individual, those are some signs that you may want to start asking some more questions, possibly looking to link with some kind of professional. For a lot of individuals, if you have a primary doctor, that's a great place to start with asking those questions. I'm noticing these things. A lot of primary doctors, they do some very basic general screenings anyways, where they can kind of see, okay, there may be something here. We want to refer you over to a mental health professional who can do a little more assessing and determine if this is something, you know, that may be of a clinical level that we need to look at treating and having intervention. And sometimes someone could be experiencing something that reaches the clinical level, but they need a short intervention. It doesn't mean it's going to be a long-term intervention, but whatever it is, I think once you start noticing some differences with the moods, with the behaviors, ability to complete tasks that they've been able to do, that's when you may want to start asking questions and seeking some help.
Thank you for that explanation. That was actually very thorough. We like that. So Danielle, back to you. Actually, first, let me just remind folks, if you're tuning in, I'm Karl Shallowhorn from the Erie County Anti-Stigma Coalition, here with Danielle Bernas from Jewish Family Services, and Kelly Dumas, founder and CEO of Dumas R.I.S.E, Providers Incorporated and private practice clinician. If you have remember, you can also visit us at our website at letstalkstigma.org to take the pledge against stigma. Also, if you're connected with a business, organization, or faith community, you can become an organizational member of the coalition. You can find more information on this on our website under the members tab. So as you see right there, That's our website that you can go to. That's the web address, and you can join us. Danielle, I know you mentioned a couple of things that you do, like yoga, hiking. Any other holistic approaches? And I mean, we say holistic, that's a very broad term, but do anything, any other holistic approaches to help yourself?
Excuse me. I'm very careful of anything that deviates from my medication. I would never go off of my medication to take on a holistic type of supplement or anything like that. And personally, I don't recommend that. However, things in combination could be helpful, different supplements that have helpful herbs in them. I have tried in the past. Acupuncture is something that I love to do and that I find very helpful. And it can really improve my mood if I'm feeling particularly low on any given day. But other than the tools that I mentioned earlier, I haven't explored a lot of holistic approaches.
Okay, thanks. I'm going to go out of order with the questions for this evening because this is a really good one. They're all good, but this is one that's really more detailed and it's really specific to the person I think who's asking. They're asking, I was diagnosed with bipolar, and what bothered me is I would have the same highs and lows while on meds. And the doctor said it takes 2 to 3 months for meds would make a difference. When it wouldn't another new medication. The alphabet soup of drugs began. Are there particular quicker meds or by holistic approach? I don't know if you want to tackle that, Kelly.
I think, and Danielle touched on it a little bit too, that is a really good question. I think this individual that's asking this is really touching on what many would probably say is one of the biggest challenges with probably anyone that's seeking out treatment and just wanting some stability when dealing with their mental health is the medication piece. That can be a very long process of trial and error. The thing is, there's so many medications that are out there, and then we all are going to have different, those medications interact with our bodies differently. And so the prescriber is going to want to make sure they find the exact medication and the dosage that works for you. I think what's most important in that process is working with someone you trust. So I can, from my personal experience, while I haven't been treated for bipolar, I have had medication for depression. I've had postpartum depression after having children, and again, depression with dealing with life situations that were at a level where I needed to be on medications. And I understand how frustrating it was. You try medication, it's not really working, or it's giving some kind of side effect where it's like, I don't really want this side effect. So for me, it was really about working with the doctor I was working with was someone that I trusted, and I knew that we had good communication. I was very transparent and where I was in the process. I'm kind of tired. I don't really, I don't like these types of things are happening. They would talk to me about other medication options, what they're recommending. Let's try this. These are some potential side effects. So it really is a process of trial and error. And so once you find what works, that's great. And then you can get stable. Now, what you also have to understand is our bodies change. And so sometimes after a while of being on a medication that's working well, we may have to make an adjustment. So I think it's part of the process. And I don't know that there's any easy solution or answer to that.
And it's different for, like you said, it's different for everybody. We all react differently. We all have,
yes.
And I say we, because I also live with bipolar disorder. We all have different ways we react. We all have different ways that our bodies change. We get older, all kinds of things happen to our brains, to our bodies. So, yeah. And I think the thing that I'll just provide my own insight into this is that it's just really important to kind of know yourself. We call that insight, right? And knowing how how you respond to certain situations, what your triggers are, and things of that sort, so that you can have a better idea of what to do when something's happening. And like I think I mentioned earlier, be more proactive than reactive. There's another question that asks, how common is bipolar disorder? I think I might have mentioned that in the beginning, but I think it's about 2.6% of the adult population, age 18 and older, lives with bipolar disorder. Question maybe for each of you, what advice can you give to loved ones who want to be supportive? Danielle, let's talk to you because you talked about your parents. So what advice would you give to loved ones who might want to be supportive?
Yeah. Acceptance, number one. Not fearing having conversations with your loved one about the diagnosis. Doing your best to understand the diagnosis, doing research or asking the individual what they're experiencing, how it's impacting their life, really kind of shaping this idea of what the individual is going through. It should be very person-centered. It's difficult. It's very difficult to support somebody if you're unfamiliar with mental health, or you've never talked about mental health, or if stigma has been an issue. And, especially in older generations, they've grown up in a very different world where they didn't talk about mental health as much as we talk about it today. And there weren't as many supports and medications available as there is today. I find that my parents are supportive in that I know if I am having or experiencing some symptoms, I can reach out to them and I could just talk to them, just talk it through with them. And they're there as the support. They're not there to lecture me. They're not there to tell me I need to do one thing or the other. They don't throw I can't think of the word, but like cliche phrases at me, like, oh, just wait, it'll go away, or don't worry, things will get better. Just really being on the phone with me or being in person with me and sitting there and sharing space and holding that space with me. I think lecturing is really, really unhelpful. And it depends on what the individual needs in terms of support. What do they need from the person that they're seeking support from? For me personally, I just want somebody to listen and to validate the things I'm experiencing. I don't need advice. I know what to do. I have all of my tools. I'm in treatment. I feel like I'm doing all of the right things. But that doesn't mean that I'm not going to experience symptoms still. And I think I want to go back on that question about the medication, because I did touch on this briefly, that it took a very long time for me to find the right combination of medication. And while I celebrated my diagnosis, it was incredibly frustrating. It was disheartening. It was discouraging. And now I'm at a point where I need to change my medication again. And so I'm trying not to revert back to that, and trying to accept that. I kind of strayed from the conversation.
That's okay.
And lost
That's
my
okay.
train of thought, but
It's okay.
it is very difficult. And I just want to validate that going through that is not easy, especially with the different side effects that you're going to experience. Stay hopeful. There is the right combination of medication out there for you. Stay patient. It is there. And like Kelly said, trust in the professionals that you're working with. If you don't find that you have good rapport with them or trust built with them, find somebody who is going to better align with you. And it's really important to find a therapist, to find a prescriber that you do align with. It's really important. And that even might take a few tries finding
That's
the
right.
right therapist.
Yes.
And that can be frustrating. And I talk very hopeful about my diagnosis, but it's not meant to belittle the challenges and the frustration with the process, because it is incredibly challenging. And as you're going through these medication changes and you're experiencing things and you're experiencing this frustration, this is where those other tools can come into place to help you in the meantime until you do find the right combination of medication.
Thank you, Danielle. That was a really great answer. How about you, Kelly? Anything you can add to that?
Yes. In terms of the question of loved
Advice.
ones and how can they be supportive of someone with, the one thing that comes to mind is, and Danielle touched on it, ask the question, what does support look like for you? Oftentimes we assume, because I think like you said that I don't need advice. Sometimes I just need someone to listen. Well, for someone else, they may be looking for advice. But if we don't ask a person, what does support look like for you, and we just operate off of what we assume will be supportive, we may miss the mark. So if you truly want to be supportive to your loved one, ask them, what does that look like? How can I support you? And be prepared that they may not know, but even allowing the space so that you don't have yourself in a position of, I know how to support you and I have the answers, but creating that space and asking that question, how can I support you? What does support look like for you? And if they say, I don't know, we can figure that out. Getting yourself educated on the bipolar diagnosis and getting as much information as you can, and normalizing talking and having conversations, because that was another thing that was touched on. A lot of times there's not open dialogue and communication that happens. I was doing some work with some young adults at a college, and I talked to them about the stigma around mental health. And I mean, overwhelmingly, a lot of them are young folks and young adults. They are ready to talk about mental health, but so many of them talked about their parents, their grandparents, their aunties, uncles. They're not ready. So they're like, I can't really talk about it to these individuals, but so they're talking about it with each other and with other folks. So I'm hopeful that it's shifting and there is more conversation, more people are feeling comfortable having conversation, but that will help in terms of, if you want to be supportive, creating an atmosphere where it's okay to talk, it's okay to not be okay, and it's okay for us to talk about it. And I think a reason why some people shy away from talking about some things is that pressure of feeling like I have to have the answers, or I have to fix it, or if I can't make it better. We don't have to have the answers. You don't have to fix it. Sometimes it's just being present and listening, just being present with the person in the moment and giving that space for them to be heard. And sometimes just for that moment, that's enough.
Thank you. Thanks.
I agree. Being heard. Absolutely.
So just remind folks, I'm here with Danielle Bernas from Jewish Family Services, and Kelly Dumas from Dumas R.I.S.E Incorporated and private clinician, private practice clinician. So you both mentioned stigma, and this is a question that came in from our audience. Remember, audience, we have a few minutes left, so there's time to put in another question if you want. But this question is about stigma, and I think we'll start maybe with Kelly. How much does stigma of mental illness, mental health affect those with bipolar or their parents from seeking help? What have you seen?
Well, I mean, I think we talked, like you said, we've touched on it a little bit. Stigma, unfortunately, plays a big role. Because of stigma, it really gets in the way of people. Sometimes folks will not want to have any interaction or engagement with the mental health system because they don't want that label. Then that results in people not being able to get the help and support they need, because help and treatment is available and it works. But if stigma is present, that means, we can't talk about this because judgment comes in. I just got to pick myself up by my bootstraps and get over it. So then people suffer needlessly, and they're not able to get the support and treatment that is available. So I think that I'm sorry, the question was, how does stigma
Yeah, how does it affect those with bipolar or their parents from seeking help?
or their parents from seeking help? Yeah, so I think all of those, it really gets in the way of having the necessary conversations, because if we're not taught, the conversations is the very first step. If we're not able to even talk about it, we can't do anything else. So the stigma really oftentimes results in the silence that happens around it. So we're not able to have conversations. We're not able to speak truth to how we're feeling, what we're experiencing, and then we're not able then to do anything about it. So I think that's the way that we address that is by reversing. So as I mentioned earlier, these types of conversations, checking in with each other and asking those questions. Are you okay? How are you feeling today? And truly giving folks time. Oftentimes we go by day to day and ask, how are you? And we may not even take the time to stop and listen, but being intentional about really checking in with each other. How are you feeling? What's going on? Making time for that, to check in on our loved ones, and trying as much as we can to make sure we are presenting in a non-judgmental way so that people can truly and authentically share how they're feeling, maybe what they're struggling with. And then we can start having more of those conversations that can help us break down that stigma.
Thank you. Danielle, how about you? Anything to add?
Yeah, so while I accepted my diagnosis, when I was first diagnosed, it took me a long time to share that diagnosis with anybody or to talk about it with anybody outside of my family. And I think that stigma in the workplace is a very real issue. And one thing that I feared for a long time is places that I've worked finding out that I have bipolar disorder, and that impacting their perspective on me and whether or not I could do my job or not. And that's something that I still struggle with to this day, because there is still stigma, right? We wouldn't be having these conversations if there wasn't still stigma. So it took me a long time to be open about it, to the point where I would talk about it on something like this, or let people know that sometimes I may need an accommodation because of my diagnosis, and that's okay. It doesn't mean that I'm not capable of fulfilling my responsibilities, whatever those responsibilities may be. And it's illegal to discriminate against somebody for a diagnosis at a workplace. So there is some protection there, but there's always a fear, in the back of my head of how people are going to respond to it. And then it's a tug of war. It's a fear, but then an I don't care. And you have to take the approach of the I don't care attitude, because this is who I am. This is what I've been diagnosed with, and I am managing it. And I know that I am fully capable of achieving what I want to achieve.
I have to follow up with you, Danielle, because this one actually ties into the idea of stigma again. There's a term that I've heard, and probably you've heard as well, and actually you too, Kelly, high functioning bipolar. So what does that mean to you, Danielle? And do you think it's a stigmatizing term?
Personally, I find the term high functioning in any context to be highly stigmatizing. I, in all honesty, find the idea of a scale of functionality to be stigmatizing itself. And it really invalidates the amount of suffering that people experience that are deemed as high functioning. I still struggle every day. I do. I still suffer. I still go through my different cycles to an extent, not nearly as severe as they used to be, but I still struggle. And I've had to learn how to almost limit myself before I reach a state where I can no longer function. And it's not a limit to what I can accomplish. It's a limit to, for me personally, wanting to take everything on. Living through mental health challenges has instilled a great level of empathy in me, and I want to do everything I can to help others who are suffering. But sometimes I need to remind myself that I am one person. I can't do everything. And talking about the stigma piece, just because somebody, or just because you don't see the suffering on the outside, doesn't mean that it's not there.
Mhm.
And it doesn't mean that that individual needs fewer supports. And unfortunately, though, because of this categorization of high functioning versus low functioning, supports do become limited or determined to be unnecessary, and the need for support is often overlooked for people who are deemed as high functioning.
That's great. Great answer. Great response. Kelly, this one came through in our questions from our audience. What are your thoughts on youth being diagnosed with bipolar disorder as children and or as teenagers?
Well, I have lots of thoughts on the diagnosing in general. I mean, on some days I look at it as a necessary evil. It gets in the way of doing the necessary work at times, and I say that because sometimes I'm working with an individual or a family and they're very, very focused on what the diagnosis is. Just because I think the society that we live in and these labels and needing. And so I really look at diagnosing. I mean, we need that to, again, help us identify what it is we're dealing with, so it can give us some information on some things that could be helpful. Now, I do think that many, you can see signs and symptoms in teenagers and youth. So I do think it's important that we, as early as possible, catch things that can be early treated and managed, and equip people with the tools that they could use to help manage and stabilize symptoms. And sometimes that is, there's a youth, there's a teen. I think, again, it goes back to who the treating provider is, the therapist, the prescriber of medications. You can have a diagnosis. I think that you want to make sure that before because, again, what does the diagnosis mean? Does that mean that I need to now start a medication regimen? It may or may not. So I think that the diagnosis is one piece, and then what are we going to do with that diagnosis, or what does that mean? And so I'm not necessarily opposed. I think, again, we need the diagnosis to get the information, but I'm more so interested in what are you going to do? And that's a question I often ask people sitting in my chair. What are you going to do with this info? You want to know this diagnosis. Because sometimes it could take 2 or 3 sessions for us to really get a good diagnosis. And so what is it that you are then planning to do with that information? So I don't think it's a bad thing. Again, I just think it's a little deeper than that. How are we going to use it? How is it going to help? What's next?
Yeah, thank you. So Danielle, I think I have another question for you, and maybe we're getting close to wrapping up, but what do you wish you had known when you were first diagnosed that could have helped you early on in your recovery journey? Of course, like I said before, I have the same experience, and I know myself, there's a lot of things I would have done differently, or maybe had learned from my experience the hard way that nobody had told me. So how about you? What do you think?
Yeah. Before I answer that, I just want to say that if I was diagnosed as a teenager when I first started experiencing symptoms, it would have saved me a lot of grief and a lot of trauma. And so if somebody is experiencing it as a child or their early teenage years, it's so important to address it before somebody gets into adulthood and is highly traumatized by their experiences. And then that's another layer that you have to work through, right? That trauma. On my journey, because I didn't know a lot about mental health, I wish I knew that medication and therapy would not be a cure. When I first started medication, I was like, this is it. I'm going to be great. I'm going to be happy. I'm going to be healthy. Like this is going to cure me. This is going to be great. And I'm going to be able to do all of these things. I'm going to be a normal person, whatever, again, normal looks like Kelly has said. I was both skeptical and hopeful and found myself initially disappointed that I would still need to manage a life with a bipolar diagnosis. And I still experience moments of disappointment that I will need to manage mental health challenges the rest of my life. For me personally, just how my diagnosis manifests. But I remind myself that I need to accept this part of me in order to move forward with my life. And I can't live my life in stasis, feeling resentful and accepting that there isn't a cure-all pill. And that's very true for a lot of different mental health diagnoses.
Yeah, and I think you go back to the term acceptance, like you said earlier, and there's a lot about acceptance and understanding your limitations, what you can do, what you can't do, and how to manage things. So I want to thank you both for the excellent conversation about this topic. But before we wrap up, I'm going to give you each an opportunity to share a few last words, maybe something that you had thought about that you didn't get a chance to share yet. So Kelly, let's start with you with your last words.
Yes. So thank you for this opportunity to be a part of the discussion. I think I would just leave by saying, bipolar disorder is not a life sentence for instability. Like we already talked about, people thrive and are very successful managing all types of mental health diagnoses, and bipolar being one of them. So with the proper treatment and education and support, individuals lead very fulfilling lives. So I'm just hopeful that today, that we continue these kind of discussions, and that these type of discussions can help us to replace stigma with more understanding, because that's what we need if we're going to shift the outlook on these things, that we need to change from stigma to understanding, and that results in us having more compassion versus judgment when we're engaging folks who are struggling with mental health or living with the mental health diagnosis. We want more compassion, less judgment. So thank you.
Thank you. I love that. More compassion, less judgment. Danielle, you get the last word.
Similar with the compassion piece. So I would say stick with your treatment, whatever that may look like Kelly said, may not be medication. That may not be the answer for you. And if you experience a relapse, utilize your support system or the tools that you have that keep you healthy. It's not a failure to need support, even to the extent of hospitalization. You're not failing. You're keeping yourself healthy, and you're doing what you need to do to support yourself in that moment. So keep hope and give yourself the rest, love, and self-compassion that you need and deserve. Thank
you so much. That's just a wonderful way to wrap things up. I love that. I love both of how you tied up the whole discussion in a nice bow, as they say. So as a reminder to our audience, we need you to take the pledge and stigma by going to our website at letstalkstigma.org. And as I said earlier, if your organization would like to join us in our cause, there's information on the website as well. Just click on the members tab to find out how. Together, we can really make this happen. So once again, I'd like to thank our panelists, Danielle Bernas and Kelly Dumas. I'd like to also thank the folks behind the scenes, Mike Telesco from Telesco Creative Group for his behind-the-scenes technical support, and Karen Karaszewski from KKPR Buffalo for her support as well. Join us next month when we will be having a special Facebook Live event featuring the documentary My Brother Lost in Time, A Bipolar Life, which chronicles the story of Paul Lukasik, brother of Buffalo-based attorney and mental health advocate Danielle Lukasik. Stay tuned for more details on this program. So on behalf of the Erie County Anti-Stigma Coalition, I'm Karl Shallowhorn. Be safe and be well.